Hey, Alyssa.
Hey, Sam.
Are you ready?
I'm ready.
Dr. Lori Brotto, are you ready?
I'm so ready.
Okay, great.
Okay, you guys, so very exciting. Today we are joined by Dr. Lori Brotto. She is a professor in the UBC Department of Obstetrics and Gynaecology and a registered psychologist. Stop me if any of this is incorrect, but I think it's straight from your website, so I'm hoping. She is the executive director of the Women's Health Research Institute at BC Women's Hospital, holds a Canada Research Chair in Women's Sexual Health, and is the director of the UBC Sexual Health Laboratory, where research primarily focuses on advancing the science of psychological and mindfulness-based intentions for women's sexual health. I'm intimidated already.
Don't be, please.
So you guys actually reached out to us, but we are so grateful that you're here because you guys are starting this. Well, you've had this campaign.
It's called Debunking Desire, and the campaign really is focused on that. It's focused on debunking the many sex-related myths that exist in our society, especially around sexuality and especially around women's sexual desire. So stereotypes such as if you don't feel hot and horny and in the mood for sex all the time, you're broken, there's something wrong with you. Myths such as everyone else is having great sex except for me, therefore I'm broken. And then a lot of myths surrounding like what are the causes of my low desire. And so really the intention of the campaign is to take some of the science, because I am a scientist and I spend a lot of my time doing research on women's sexual health. And so using the campaign to share the key findings from the science and get them into the hands of women so that they can benefit from it.
How did you get into this? Because this is like your whole life. How did you get into that specifically?
You know, it's really funny because I grew up in a really conservative Italian Catholic family and fell into sex research in rodents, actually. I started out as a volunteer job, volunteering in a lab that was looking at the effects of medications and pharmaceuticals on sexual behavior in rats. So I did that for about 6 years as a student and as a master's student. And then the year that Viagra was approved for men, and you all know Viagra is a blockbuster pill, the little blue pill that restores erections in men with erectile problems. That year that Viagra was approved for men, there was a really big study that was published. And what the study found was that 40% of women across ages have ongoing and distressing sexual problems. So I looked at the science then of, what do we have for treatments? So many more women than men have sexual problems. We've got this amazing drug that can be taken discreetly and cheaply, et cetera, for men. What do we have for women?
Right.
And there was nothing. So pretty much that day I shifted my research. I was still a student at the time, a PhD student, and then really focused on women's sexual health from that day forward. And then because I was also training as a clinical psychologist, I think it was the stories that women told me when they came into my office, the stories of secrecy and shame and the tears and the, oh my gosh, I've never told anyone that sex hurts or that I have no desire, yet I love my partner so much. So it was sort of the life experiences combined with just this dismal state of the science that steered me in the direction of wanting to devote my life to studying treatments that were safe and cost effective for women.
I have a question for you right out the gate here. I'm curious how much desire has to do with attraction. So if you have low desire, does that automatically mean that you wouldn't be attracted to that person? Because I think there's a lot of stigma around that in relationships with people.
Yeah, when I'm in the clinical role and seeing women and their partners together, that's often the concern is, oh my gosh, does this mean I don't love my partner? So that's definitely a concern that people have. And just as you can have sex without love, you can have love without sex. So love and desire don't have to go together. And then the other part of it is, what about attraction? Does this mean that we just don't have chemistry? And a lot of people really kind of hold to that idea that you either have immediate chemistry with someone and it's not something that can be forced or created, or you don't. There's actually no science that really supports that this notion of, you have to have chemistry and an immediate attraction with someone in order to have sexual desire for them. So just to kind of dive into that a little bit deeper, there's different kinds of desire. There definitely is this kind of spontaneous desire that happens out of the blue, a lot more common at the start of a relationship when everything is new. And a lot of that is driven by the reward systems in the brain, like the dopamine center, right? So when you really crave something, that's dopamine at play. And that's usually desire in the early stages of a relationship when you're infatuated with someone. You can't wait to have sex with them.
Like the honeymoon phase.
Yeah, and it fades. It does fade. And for some people, it fades within a few months. And for others, it fades within a few years. And so that is normal. There is nothing problematic or wrong with you to have that kind of spontaneous desire fade over time, but it gets replaced with a different kind of desire. And this is the really important message that I think women need to hear, is you can actually cultivate desire, but it means paying attention to what are the things that turn me on? What are the things that have to be in my environment or in my head or in my interaction with my partner or partners in order to bring that desire out. So I sometimes use the analogy of going to the gym. And if you've ever been like in a gym lull, how do you get to the gym? Well, you put the runners out, you put it in your calendar, you remind yourself this is a good thing to do. You don't want to go, but then you get there, you have a great workout, the endorphins run, you say, I'm so glad I went to the gym. And desire in a longer term relationship often looks like that. So what it means is that it can be pretty normal for women to start out an encounter without desire, but then it kicks in at some point during the interaction. If she gets aroused, if she feels pleasure, if she feels good, if she feels her needs are being met, then desire can kick in. So it's a different kind of desire we call responsive desire. And it's important that we recognize that women can have both, or they can have one, or they can have the other, and it's normal.
Right. So basically, I need to tell my partners what I like, and then it'll feel good. Wow. It's so funny because it's so much easier said than done. You know what I mean? Like, I've definitely been in relationships, and we've talked about this before, where, being a little bit younger and stuff like that, it feels uncomfortable for me anyway, because I grew up kind of having this notion of like, I'm a female, I don't poop, and I don't ever have hairy legs, and I don't grow armpit hair.
Okay, I will say Alyssa actually doesn't ever have hairy legs, because she does shave her legs once, if not twice a day.
Because I'm still stuck there, Sam. I'm stuck in the bubble. And so talking about stuff like that and feeling comfortable being in a vulnerable position already, and having those conversations can be really difficult. But I totally agree. Once I started having those conversations and being like, oh, maybe let's do this, or even the preemptive, because I have found excuse me, that my desire is so much linked to, like, I'm not like a spiritual person, I won't say, but like to a spiritual connection. Like, we're like vibing with each other, and like you're looking at me, and like I'm looking at you, and I'm like, it's about to go down. Do you have advice? I guess you can't give like specific advice, but from your research and stuff on how to actually like approach those difficult conversations with people who like might not be super comfortable yet.
Yeah, I think your opening comment, which was a bit facetious, but is so on point, and it is, oh my gosh, if I tell a partner what I like, right, does that mean I'll actually get what I like and it'll feel good? Yes, 100 times. And the reality is that we don't do that. And I have the luxury of actually being able to dive a bit deeper into figuring out why, like what are the barriers about. And women will often say, oh my gosh, if I tell partner what I like, they're going to assume I'm doing it wrong, right? Or they're not stimulating me in the right way. Or am I going to communicate that I'm actually not attracted to them? Or am I going to communicate that actually I don't have desire for them? And, I have a lot of gay male friends where talking about sex ahead of time, coming to an agreement about what they're going to do and what it's going to look like is just part of the sexual encounter. And so I often say, we could probably take a page out of our gay men friends' sex lives, because they do negotiate. They do talk about consent. They do talk about what they want to do and have no qualms about asking for what they want. For us, it's a lot harder to do that. So what I would say is there's so much benefit to be gained by telling a partner. And there's a way that you can say it, right? And so I'll often say, use your I language. I really like when you do this to me, or let me show you, honey, where to touch, and you gently move their hand there, as opposed to you're doing it wrong. Stop
Right.
doing that. So definitely the words we use make a big difference. But because I often talk to partners as well, they will say how relieved they are to be told how to touch and how to stimulate and understanding what she really likes. So everyone wins when we communicate about sex.
Yeah. I think it's so funny too, because like when I'm being intimate, I don't want for my partner to be in pain. That's my goal, is for them to feel good. And it's so interesting that I've spent so much of my life being so uncomfortable wondering how I can achieve that goal, when in like every other aspect of my life, I'm like more than happy to be like, okay, how can I do this better? But you know, and maybe better is the wrong word, but more effectively for the partner that I'm currently with, sort of thing.
Yeah. I'm curious on your thoughts on this. I watched a TED Talk this morning. It was called A Sex-Starved Marriage. And this lady in there, I believe she actually was a doctor as well. And she, her comment was, what should men be doing? You should be listening to your wife. You should be, you know, there for her emotionally. What should women be doing? Adopting the Nike philosophy, just do it.
Yeah, I mean, it's wow. It's not just one thing, right? So there are definitely truths in that, and the Nike philosophy of just do it. It certainly it aligns with what I was saying earlier about, you know, go into sex for the right reasons, but don't just go into it because you think you have to.
Right.
And definitely don't go into it to avoid a fight, to avoid resentment, for what we call avoidance related. And actually scientists, there's a whole body of science that has looked at why do people have sex. And believe it or not, there's 237 reasons, discrete reasons that people provide for having sex.
Wow.
So things like, I want to feel pleasure. I want to have an orgasm. I want to communicate I love you. It's their birthday. It's to get to sleep, to revenge sex, et cetera, et cetera. But if you're having sex to avoid something bad happening, so what I often hear is, you know, if I don't have sex once a week with my partner, they are very difficult to live with. They're mean to the kids. They throw things around in the house. I can't communicate. And so she continues to have sex with them. That is a perfect recipe for resentment and painful sex in the long term. So all of that is to say, you've got to have reasons why you're having sex. And the reasons can be different every time. So maybe this time it is about that great orgasm. And maybe it's the next time it's because this is a great way to fall asleep. Or some women after orgasm will find that there's like an analgesic after effect. It takes their chronic pain away. So it's more complex than nuanced than just do it. The other thing that I feel an obligation to say is consent. And even in a long-term relationship, it behooves us to revisit consent, because a lot of women feel like they're not having consensual sex, but in their heads they'll say, but I'm married, so therefore it's not sexual assault if we're married, right? I'm staying because I want to. But that is a really, really important topic to address, the topic of consent. And do I actually really want to be having this?
Well, and I think as well, like making sure that people don't feel like there's any reason why someone would be entitled to your body. And I think that a lot of people do feel like that, like you said, like in relationships and stuff like that, well, I should be doing this. So that makes it okay, even though I don't want to, because like, you know, this is my partner. Yeah.
Yeah, you know, the entitlement thing, no one signed up. No one signed a contract that said, you know, when we enter into this relationship, this gives you the full rights to my body.
Right.
Never. I don't know any woman who has signed that contract, whether it's been explicit or implicit. And so it comes back to the notion of, this is a consensual thing. And that means revisiting, do I want to be doing this? We also need to recognize that there may be times in your life where you don't want to be having sex. You've just had surgery. You've just had a baby. There's other things that you have a yeast infection, right? And that is normal to go through periods of time where you're not having sex. I probably should also mention for the listeners that there's lots of, well, not that I have to, you know this already, but it's a good reminder that intercourse is just one kind of sex. And if we think about a buffet table or a tapas, that can be really useful for the periods of time when intercourse or penetration is not an option for you, right? Because of a yeast infection or because of whatever the reason is. And in fact, oftentimes those other kinds of sex are a lot more pleasurable.
I really like that. So with debunking desire, I kind of want to get back to like the actual desire part, because I'm so interested. As a 26-year-old woman, I have gone through periods where I felt like, in my mind, like zero desire. And that was really concerning for me, because you hear, like, growing up that women only get like friskier, you know, as they age. And I was like, am I broken? Like, am I reverting? Like, my fertile and excited years are gone. And then I did eventually come out of it, and I'm back and better than ever. So sorry, Grandma. And but
you got here somehow, Alyssa.
Yeah, exactly.
Thank you so much. But I wish that somebody would have kind of like, why you were already debunking it, but I wish that I would have seen that. And I think that a lot of our viewers and listeners even probably don't understand that there are so many things that go into desire, not just I'm broken.
Yeah.
So I kind of want to know, I did read up a little bit, but I feel like we have so much time here, so I'm so excited. I kind of want to know, like, what are those things that contribute to desire? I mean,
yeah.
So,
again, part of the campaign is to debunk the myths. And one of the myths, it sounds like you faced, was only old women lose their desire, right?
Right.
It only happens after menopause. And that's a complete myth. And when you look at the science, and this actually has been studied in many countries of the world in large samples of women, low desire is actually not affected by age. In other words, a young 26-year-old woman is as likely to experience a period of time where she loses desire as a 66-year-old woman. Now, definitely there's changes with menopause that we can talk about later that contribute more. So first of all, we need to kind of dispel that idea that it only happens to older women. You can be a young person. In fact, some of our research that we've done has looked at really high rates of sexual problems in young people. So adolescents, people who are just starting out in their sex lives, and not having desire, difficulty with orgasm, feeling pain, etc. So it circles directly to your question, Alyssa, which is like, what are the main causes? And I usually get asked by the women I see, is this hormonal? Are my hormones out of whack? Do I need to go have my testosterone checked? That also has been studied up and down, and actually testosterone contributes very, very little to women's sexual desire. It contributes a lot more to men's sexual desire, but for women, almost nothing. And all of the studies that have been done have found no relationship when you correlate blood levels of testosterone with her reports of desire. There's no relationship. There's been about 20 studies that have done and find no relationship. So then, what are the causes? And lots of different studies have looked at this, including several of our own. And the reasons can be really complex, and there can be a lot of different reasons happening at the same time, but by and large, they tend to be more psychosocial reasons. So things like ongoing anxiety, ongoing stress, even day to day, like the chronic to-do list and never feeling like you can get off that hamster wheel. Depression can be a major contributor, and that makes sense because depression by definition is apathy and lack of interest. You lose interest for the things in life that usually give you pleasure. Sex is one of them. So we often look first at mood-related anxiety and stress-related contributors. And then there's a whole list of other things that I think fly under the radar, things like fatigue, right? Not sleeping. Sex takes energy. It takes physical and absolutely emotional energy. And if one is chronically sleep deprived, that's going to completely contribute. And then there's a whole list of belief-related factors. So beliefs that get in the way. Things like worrying about the outcome. Will I have an orgasm? Will I please my partner? What if I leak a little bit? What if I make a smell? Oh my gosh, I didn't shave my legs. Are they going to notice? It's too light to have sex and they're going to see that body part that I don't like. So we call those, psychologists call these cognitive distortions. They're basically beliefs that impact how you feel. And there's been a lot of research that shows those potent negative beliefs can actually directly affect our body's physiology and our ability to get aroused.
Oh, wow.
It's amazing. And so, changing your thought patterns and becoming aware of what you're thinking and replacing the inaccurate stereotypes with accurate beliefs is super, super powerful. And then, of course, there's more medical and physiological reasons, things like chronic pain. Definitely, if sex hurts, you're going to lose interest in doing it. It's an adaptive thing. We avoid the things that give us pain, right? You touch your hand on the stove once, you're never going to touch it again. Right. So if sex hurts in any way, you're going to lose desire for it. A lot of medications can get in the way, antidepressants, absolutely, but even a lot of more common medications like nasal decongestants and neuroleptics and etc. can also interfere with arousal, which can then affect your desire for sex.
Okay, listen, I've been on nasal decongestants for 3 years, okay? It's like the one thing we didn't take out.
But it's interesting looking at both of your eyes went bing. It's like, why didn't the pharmacist tell me that?
Well, exactly. Oh my God, I've been saying this for years. It
Right?
drives me crazy that they don't talk about, even with like birth control. I think we might have talked about that in the doctor one, but like it was crazy to me that I had been getting birth control from doctors for years and years and years, and none of them had told me any of the side effects. And then one day I was like Googling what the side effects of birth control can be, and I was like, oh, like literally like a whole host of my problems. It is crazy. It's so
and there a lot of doctors are either they don't get the schooling, the education around how do you talk about sexual health, etc., or they bring their own personal baggage and they think it's inappropriate, or they're embarrassed, or the reasons are simply not good enough, but it is the reality that most doctors are not talking about. That's actually part of what I do in my role in gynecology, is I actually train our medical students how to ask about sex. And then I force them to practice on me. And then because they're in a safe environment, I can actually correct what they're saying and teach them how to do it in more of a non-biased way.
I never even thought about the fact that doctors get embarrassed. Oh. Like I was like, no, they don't. They're perfect. like somehow they just, because they're doctors, they don't have emotions. I've never thought about that before. Yeah. Oh, wild.
Do you find that like sex is overall under researched, and if so, why do you think that is?
Yeah, it totally is. Oh gosh, I could go on and on about this. So I did part of my training, my schooling at the University of Washington in Seattle. And I was in a great institution. It was, really well resourced, fabulous people. And because of all of the taboos, and at the time it was a very right-wing government, and I actually had colleagues that were getting their sex research studies defunded. So I turned down a number of job offers and moved back here. I'm originally from here. Where funding has been easier than in the States, but certainly not easy. And so when I started doing this work, I had to piggyback the sex research on something more, quote, legitimate. So actually a lot of my early research was in sex and cancer. So the focus was on cancer and cancer survivorship, and sexual dysfunction was just one little add-on. But for me, that was actually the main interest. And that was the case for probably about 10 years of my research. So if you look at my early work, almost all of it is in sex and cancer for that reason.
Wow.
Thankfully, it was really good work and made an important dent. So to answer your question, Sam, yeah, it's underfunded, it's understudied. Yet at the same time, the World Health Organization, like the global body that defines health and health standards, has said that sexual health is a core aspect of quality of life. Mm-hmm. It's a human right, and so is pleasure. Those who want pleasure have every right and deserve to feel pleasure. So we're seeing the tide changing a little bit. But still, it's nowhere near where it needs to, the funding rates need to be. And, when we look at how common sexual concerns are, I mentioned the early study that found 40% of women have sexual problems. By comparison, things like diabetes or asthma, which are absolutely life interfering, but are a fraction of the prevalence that sexual dysfunction is, yet predominate all of the funding that gets, because they're far less stigmatized than sexual problems are.
Yeah. Right. Do you think that like social media is beneficial in terms of, there's a lot of conversation around women that are like sexualizing themselves online. And do you find that that's actually beneficial, or do you think that kind of hinders the conversation around this stigma?
Wow, it's a good question. You know, the feminist in me, which is my core, says that we should be able to, and we deserve, and we're entitled to be sexual in any way that we want, that as long as it's consensual and we're not harming anyone, including ourselves. So that part of me says, you know, we should be able to be pro-sexual and celebrate our sexuality on social media. Then there's the pragmatic side of me, and that is the side that knows our history and knows the history of how women's sexuality has been treated. Women's sexuality for the longest time was either diagnosed as frigidity. So frigid, that term frigid, was actually a diagnosis. So women who were not were not interested in sex. I hope your listeners can see your reactions, because yes, this captures it. So frigidity was a diagnosis, or the opposite end was nymphomania. And
oh my God, you can't win.
No, you can't win. You're either
everything
frigid or a nympho, and that is our. So there's a legacy of pathologizing women's sexual desire into one of these two equally bad camps, and so that's the pragmatic side of me that I worry about. So on the one hand, I love women celebrating their sex. Like, I wish we could go on a social media and say, I had the best orgasm yesterday. Here's how it felt. And I know within 5 seconds, she's going to be labeled and stigmatized.
Well, and also, like, it will probably be content that's taken down. We had, I have made videos about, like, menstrual cups, always demonetized on YouTube.
Really?
Which, like, that's,
menstruation, for God's sakes.
Well, and 50% of us are like, but it's weird that that's seen as, like, you know, a controversial topic to the point where, advertisers won't want to put their ads to that kind of content. And then I feel like the ones that we do, like talking about sex, a lot of the times end up getting demonetized as well.
Yeah,
or
addiction, as well. The we went there episode, we actually tried to kind of like skirt the demonetization by labeling it we went there,
instead of something having to do with
STIs or anything like that, because we knew that if we labeled it that, it would get demonetized, but somehow they still caught us.
They found you.
Yeah.
Well, what was happening when I was in the States for a while is there was a very, very active right-wing group. So when scientists get a research grant, they actually make our abstracts, which is like a summary of what we plan to do. They make those public. And this small, very active, very influential right-wing group was scouring the internet. They would basically do keyword searches, sex research, funding. And they would just read through abstract after abstract. And then they contacted the funding agency and threatened that if they didn't take the money away from those sex researchers, that they were going to go very public and let taxpayers know that their money was going towards understanding prostitution. So it is, but you don't want to take a risk, right? So it is, it's pretty scary, and you do have to be pretty careful. So I know I'm not answering your question, and obviously it's a complex situation, a complex answer.
Yeah.
It's so crazy to me that like that's happening. Obviously it is, but it's just like, where is the benefit from us taking money away from sexual health research? Like, what are you benefiting from that? Continuing the stigma, I'm assuming. And
I also think it's so funny because, you know, when we talk about the kind of political conversations in America surrounding abortion and stuff like that, and people, you know, trying to get that so that's like illegal, like nationwide. And it's interesting because a lot of the times the same commentary around gun control is that, like, well, it doesn't matter if you make it illegal, people are still going to do it. The same goes for abortions. So people aren't going to just stop doing it. They're just going to do it in a way that is significantly more dangerous.
Yeah. Totally, 100%. Yeah. You know, things are a lot better in Canada. First of all, we have a feminist, for all of his problems, for all of his issues. We do have a feminist prime minister who is intent on equity. And actually, since Justin Trudeau has been in his position, we definitely have seen benefits to reproductive health funding in our hospitals and in our programs. There's still a long way to go. But when you compare that to some of the stances of some of our premiers across Canada, for example, the case in Ontario. I mean, Ontario used to be we used to look up to Ontario for having an amazing sex education program. I know you covered sex education in one of your podcasts a while back. Ontario used to have the best sex education program. They used to teach 5-year-olds in kindergarten the body parts, like vulva is different from vagina, is different from scrotum, is different from testes. And then when Doug Ford came on last year, a year and a half ago, he reverted back to like a 1950s model of sex education where you're no longer allowed to teach kids the specific body parts. You have to label everything genitals, everything.
But how does that serve anyone?
No, it doesn't. It's fear mongering. It's based on, I think, a set of beliefs that if you give people education, they're going to do bad things with it. It's like the HPV vaccine. If we vaccinate girls in grade 9, suddenly they're all going to be out having sex. If we put condom machines in bathrooms, suddenly everyone's going to be having sex. None of the science supports that. Actually, what the science shows is that condom machines and HPV vaccine actually decrease unintended sexual activities and unintended pregnancies because you're empowering people with education.
Right.
So yeah, it's completely not based in science. It's very, very frustrating because the science exists, right? We just need to share it. But when you see this happening on a political level, it just makes you it just baffles your mind. It's very frustrating.
And it's just so frustrating that like sometimes people get annoyed with me because like when I have conversations with them, I'm like, okay, but where's your like evidence? And someone recently said to me, I feel like if I don't have a peer-reviewed journal article, you won't believe me. And I'm like, I won't. I'm like, if it's out there,
right, yeah.
Why would you not? And of course, like I'm human. I make mistakes. I'm not educated in the way that even, the people in front of me are. But I try my best. And it's like, if the information is out there, so why are you deciding that you're right because you're right?
Yeah.
When there's actual scientific evidence that you're wrong.
Well, and if there's something that you are passionate about to have like, an argument on it, wouldn't you want to know what's what? Like what's right with that?
Yeah. I want to take it back a little bit because you'd mentioned it a couple times about genital pain. And this was something that I didn't think about for a really long time, is that you can have painful intercourse without having an actual infection. Mm-hmm. Can we talk about that a little bit?
Yeah. What do you want to know?
So I don't want to speak out of turn here because this is like a story that Sam told, but I brought up the topic. So thank you. Consent.
Awesome. Love it.
So Sam had mentioned a story in the We Went There episode where she was having painful intercourse with her partner, and she went to the clinic and they did all of these tests. And what was it that the doctor ended up asking you? Sorry.
Well, everything was coming back normal. So I had been into a couple doctors, but I had been into this one doctor like over and over and over again. And everything was coming back normal and there was no issues. And then at one point she was like, do you like feel comfortable with your partner? And it was so like astounding to me to think that like, I've never been asked that in this conversation, but like, that is obviously, why would that not be a massive part of this? And then we kind of just went from there. Like she was like, do you trust them? Do you, like, and at the very end, she was like, I don't want to like sum it up to just this, and we can keep doing tests and I'm not going to like let you, like we can figure it out. But she was like, stress does really weird things to the body.
Yeah.
It can cause that pain. And she was like, I would be interested to know, if you were to be with another sexual partner, I'd be interested to know if this was still an issue, and it never was again.
Yeah. So you're really lucky. It sounds like you had a healthcare provider who got the good sexual health training that we provide. That's not the majority of family docs or gynecologists, unfortunately. Yeah. So pain, I mean, there's the obvious reasons for pain that a doctor would see on an exam, something like a yeast infection. There's also a whole slew of skin conditions. So just like you can get psoriasis or eczema on your arm or your face, you can get it on the vulva as well. So lichen sclerosis and lichen planus are two skin conditions that can be really, really painful and are treatable, but they need to be properly diagnosed. Most of the other pain conditions, which is the majority of them, you don't see anything on an exam. So even a chronic pain condition like provoked vestibulodynia, PVD, basically sex when sex hurts, and affects about 20% of women, you don't see anything. There's no redness. There's no discharge. You see nothing. And so women often get told, it's all in your head. In fact, we had a social media campaign 2 years ago called #It'sNotInYourHead. And it was focused on provoked vestibulodynia and the fact that women with awful, they couldn't even wear tight jeans because the seam on the jeans was provoking the pain for them.
Oh, wow.
And for those women, stress might not have been the cause of the pain, but it was definitely a perpetuating factor. It was a reason why they kept, why the pain was continuing. And it's because stress changes your brain, right? So we know chronic stress absolutely changes your brain and can change the pain centers in your brain. And there's been a ton of neuroimaging studies where you bring people into an fMRI machine, you look at the brain, you have them even imagine pain, and you can see the pain centers lighting up, and they will say, I feel pain. And you don't see that on a physical exam. So I think the heartbreaking part of that is how many women were dismissed by their doctors. Our research on this pain condition shows that it took an average of 7 different physicians over the course of 5 years to get an accurate diagnosis. Meanwhile, as time goes on, month by month, year by year, her pain's getting worse, and the interference in her sex life and in her relationship is getting worse. So provoked vestibulodynia, super common, about 20% of women.
Yeah, that's high.
Really high, and we're not talking about it.
Well, that's what I was
all.
going to say. We were chatting just a little bit before we started filming this episode, and I was saying I feel like I'm very open about sex with my friends and partners and stuff like that. And if I can be so bold, the fact that I had never heard of this and it's so common, I was like, how does anybody else know about this? Mm-hmm. That's so crazy.
Yeah. So, kudos to you for actually asking the question on the podcast, because all of your listeners and, just based on the prevalence, there's a good number of your listeners who likely have this. And my hope is that they're hearing this and they go back to their doctors who have dismissed them, and they, print out the crib sheet on provoked vestibulodynia and say, is there any chance it could be this?
Right.
And then Sam, just your point that your doctor suggested to you, like maybe it's partner specific, and sometimes pain is partner specific. So our bodies have evolved to protect us from things that are painful. And we've all heard of Kegel exercises. And I think what a lot of people don't know is that sometimes the pelvic floor muscles tighten up involuntarily, and they do that in a way to protect us. And when that happens, it basically closes off the opening to the vagina, because the pelvic floor is right behind the vagina. So if there are any issues of feeling unsafe in a relationship, maybe even feeling unsafe with that person, or not liking that person, or being belittled by that person, the body says no. Like the body will close off. And so my prediction is what was happening in your situation is the pelvic floor muscles, which had the guts to say, he's the wrong person. They closed off, sex hurt, and then you're in a safer, better, healthier relationship, and suddenly pelvic floor muscles are like, yeah, I'm happy again.
Crazy. It's just so wild to think that that's a thing that we're also not taught, because I feel, going back to talking about sex education, I feel like in school, I'll never let this die. I feel like in school, the only thing we are allowed to talk about, because it's deemed appropriate in Canada anyway, is sex in terms of how you can practice it safely, but not in terms of anything for pleasure, which I guess I do understand, because then that sort of is in the realm of inappropriateness for teacher student, you know what I mean? So I understand that, but I just wish that there was something else where we could talk about this, because, well, there is now social media, but going back to what you were saying too, keeping it a secret doesn't mean we're not going to do it, and whether I was educated about sex or not educated about sex, I was going to start having sex. It's just just the way, and like you said, it's our human right as well. And so it would kind of be nice to know and not feel like, hey, I'm broken because something's happening to me. And something similar did happen to me where I was feeling pain as well, and I was like, oh well, I mean, my partner's cheating on me or something like that. And I'm like, because I've been faithful and here I am. And And thankfully, Sam had opened up to me about that. And I was like, could this be what it is? And I mean, it turns out it was. And I'm just like, this is so wild that this is a thing that we're not talking about. And like, just as with the STI conversation, how many people opened up to me about their experience with STIs, I can't help but wonder how many people are going to open up to me about this as well and be like, oh my goodness.
Yeah.
Right?
Well, I wonder like how many people just do think that it's their fault. It's something that they're doing wrong, as opposed to like, you know, your body's reaction to what's happening.
Right. Yeah, we don't listen to our bodies and trust our bodies enough, and we spend a lot of time in our heads. I actually have a book called Better Sex Through Mindfulness, and the entire book, the reason I wrote it is because I know no one reads my medical articles.
150 peer reviewed,
except my students, of course, but no one else reads them. So the book was an opportunity to take the science and share it with the masses. And our research on mindfulness shows that, you know, if we can get out of our heads and into our body, we start to feel pleasure. We start to feel arousal, even at its earliest signs. For the women that I work with, say, a cancer diagnosis or a surgery or multiple sclerosis or some other reason why arousal is low, our research shows that, you know, if you actually pay attention to it, which means you need to be there, you need to be noticing it, you can amplify the arousal just by paying attention to it. So we spend way too much time in our heads when it comes to sex and not enough time in our body. And Alyssa, this speaks directly to your point about like, why aren't we talking about pleasure in sex education? So there are guidelines, Canadian guidelines that came out last year from CCAN, and any of your listeners can go to the website, it's free. CCAN is the Sex Information and Education Council of Canada. And they did a really, really thorough stakeholder engagement interview process where they put together the best sex education that could possibly exist in Canada. And they put it out to Canadians, and they're waiting for school districts to take it up and implement it. So we've got the program. It's evidence-based. Oh, wow. There's a whole module on pleasure and why paying attention to pleasure and being educated on pleasure can actually protect against future non-consensual sexual encounters as well, in addition to just being a good thing to do. But the barriers are at the school district levels in wanting to implement this.
Right.
How do you feel like in terms of, because I was going to ask like what you thought needed to change with sex education within schools, but for people that are outside of school, how do you feel like, you know, getting across that information, like what is going to be the easiest way?
Yeah, I mean, social media is great because it's accessible, it's free, and that's part of why we developed Debunking Desire. And we have a website, debunkingdesire.com, that Melissa and Bryn put together with a toolkit, and the toolkit has easily digestible and downloadable and shareable tidbits of information, and then a lot of resources to point women to. The problem is wading through all of the, you know, garbage that exists out there. And unfortunately, there's not a good way to do that. So you can come to us and we can point you in the right direction. But there is good information.
You're about to get a lot of emails.
Yeah, well, I'm happy. You know what? Because then what happens is if one woman is educated and empowered, and I always, whenever I give a talk, I say, please share one thing you learned with another woman, because then she'll share it with someone else and you have the nice, you know, pyramid effect. So yeah, the challenge is how to get the accurate information into the hands of women. The information is out there, but navigating that in order to access it is really important. The other thing is, family doctors and primary care providers play an important role. And so if you find that you're being dismissed, either ask for a referral elsewhere. I recognize how hard it is. Yeah. Like 50% of British Columbians don't have a family doctor. But if you do, just keep asking, keep persisting. Don't settle with being dismissed.
Right. And I think that that's a really good point, is that because even my brain always goes so fast, and then I start like 3 different conversations in my own head. With all of my like chronic illnesses or chronic pain, I'm so quick to advocate for myself in those ways. But when it comes to anything sexual, I'm kind of just like, oh, okay, it's fine. Like, you know, and it's kind of even that stigma within myself of like, okay, these are valid because I have a bone fracture, or, you know, I have chronic rhinitis, like that, it's something tangible. But when it comes to something that is intimate, I'm like, well, no, that doesn't matter.
Yeah.
Right.
And I would challenge you and say, listen to what you just said. You know,
Yeah.
you're basically depriving yourself of a fundamental part. So I want you to remember the World Health Organization has said sexual health is a fundamental right. It's a core aspect of our health and our quality of life, in the same way as bone health and mental health and hormone health and everything else health is. It is part of your health package. And the consequences when sex isn't going well, if it hurts or if you have low desire, the consequences can be pretty significant. It takes a toll on your relationship. It creates anxiety and stress, can trigger a depression, can lead to fears. It can lead a woman who's not in a relationship to avoid meeting someone.
Yeah.
Which is devastating.
Right here. Oh my God. I'm like, I don't want to have anything to do with men.
Yeah.
Like, I've never been, that's so interesting.
Yeah, that was something that was really scary for me too, leaving a relationship. Was I was like, what if I go into another relationship and I don't want to have sex and they don't want me?
Yeah.
And it's so interesting hearing it put so like poetically together by yourself, instead of me just being like all over the place. But it is so true. There are so many consequences to not taking that part of you seriously. Yeah.
I was having problems with low libido, and so I was going in, and I decided that I was going to go on medication for depression. I was really against it for like a super long time, but when I was researching it, I was seeing that like often causes like low sexual desire, and so that was the first time I'd ever brought it up to a doctor. Well, I guess other than the pain thing, but in terms of like low desire, that was the first time I brought it up, and when I told my doctor about it, I was like, I want to go on antidepressants, but I don't want anything that's gonna like affect my libido. And like I like looked down and like covered my eyes because I didn't want to have to like look at him and, like while I was saying it, because I was so embarrassed. Like it was such a weird thing to just like say to someone that's not part of like my intimate relationship.
How did he respond?
He was like, great, let's put you on Wellbutrin.
Oh, okay, good. Fabulous. Yeah, I mean, he should have asked you a few more questions before, but that was, you know, he listened to you and he actually made a good recommendation. Yeah. So antidepressants, it's actually not necessarily desire that affects, it's arousal and orgasm that antidepressants, just when you look at how they act in the brain. But of course, if arousal goes down and you're someone who enjoys orgasm and those feelings of pleasure, of course it's going to affect your desire for sex. So they're definitely all connected. So yeah, Wellbutrin is a good suggestion.
It's gone well.
Good.
Yeah. It's so, we are going to get like so many, it's so interesting comments. But it's so interesting that you said that you had to look down, because I had decided that I wanted to like take my health really to the next level. And this isn't even the next level. See, why am I even making excuses? Anyway, I wanted to get like a full panel for STIs and things like hepatitis and stuff like that, because I hadn't done it in a really long time. I think it had been like 4 or 5 years. And I went into my doctor like armed with this story as to why I wanted to do that.
Like she was going to be like, I'm not giving you those tests.
I was just like, I'm just like, when I've traveled a lot and all these things. And she was so sweet. She literally put down her pad and her paper and she said, there's nothing wrong with asking for this. And she was like, I have people who come in and ask me to do this once a year, every 6 months. It's up to you. Let's do it. And I was like,
what a woman.
Oh yeah, truly, what a woman. Yeah. But it is so true. It's again, if you came in and somebody was like, I think I've broken a bone, it's like, okay.
Right. Would you like hobble out without saying anything about it, right? Exactly. And that's the reason,
though.
Right? It's okay. Don't mind this.
Yeah.
I think it'll set itself. It's okay.
Yeah. Well, I mean, I'm really glad to hear that you found the courage to do. It's ironic that we have to say courage,
exactly,
right, to ask about your health, but it does take courage again because there's so many stigmas and taboos. But a lot of women just suffer in silence and they don't bother because or they have the intention to talk to their doctor about it, and then they get to the visit and they're looking at the doctor and they can tell the doctor's rushed, and so they decide against it.
Yeah.
And that's really common and not acceptable.
Yeah.
I'm curious because you've like dedicated your career to this, I'm curious what your goals are surrounding, research and funding for sexual health and like spreading that conversation.
Yeah. I mean, I imagine a world where no woman has sexual problems. That's my vision. Really lofty, but probably unrealistic. Again, because we live in a high stress society where there's a lot on the go, and there's those reasons for sexual problems are just surrounding us. So I mentioned a lot of my research is on mindfulness-based interventions, which we know work. We've shown that over and over in different studies with different populations of women, following women over years. It works, and the benefits are lasting. Now I'm really focused on access. So how do we get these effective psychological skills-based interventions out to the women who live in rural, remote parts of the province and the country? How do we get them to marginalized groups of women, the women who have been dismissed by doctors because of their color or because of their sexual orientation, or because they're in a non-conventional relationship? They have multiple partners or what have you, or they're single. So we've really, over the last couple of years, been focused on developing web-enabled versions of our face-to-face interactions. We've been doing a bunch of feasibility testing. Like, does it work if we take our face-to-face skills that we deliver that work and move it online? So that's been a huge interest of mine within this research space. And then the knowledge translation, which is this whole field of, the science is there, but there's this gap in getting the science, first of all, into the hands of women who can benefit, into policy. Like, can we actually change policy where we mandate training in sexual health by our family doctors? Like, it's required training in your residency that you have to have training in sexual health. And you don't graduate with your family doc certificate until you've passed. And that means more than just getting education. You have to actually do a mock interview where you ask someone in a sensitive way. So that's a huge goal of mine.
Is that not a thing right now?
It's not. No, it's not a requirement. No. Yeah. I know.
That is shocking to me.
Yeah, I know.
Oh my goodness.
And in BC, we're doing pretty well, but that's not the case for most of Canada, where there's no sexual health training. So that's kind of a lofty goal as well. And then, closing this gap between bringing the science out into the public and making it a normal part of our conversation. So I can stop having women who come into my office and say, oh my God, I've had this problem for 15 years and I've never been able to tell anyone. I've been so embarrassed. It has to stop again, because as we were just saying, we wouldn't do that with other parts of our health. So I almost would like to see kind of the status of sexual health elevated in our society and it being recognized. And I actually think it's going to take a politician who has a sexual problem to, have this be part of their platform. And this happened 15 years ago in the States when Bob Dole was running, and he was on Viagra ads, and suddenly everyone was talking about Viagra, and it was okay to talk about the little blue pill. Okay, great. That's great for you, but what about women's sexual health, which are far more common?
Right.
So, we need to get a lot more comfortable talking about it in public spaces and get some of our leaders advocating for the need for us to talk about this too.
What would you say is the difference between, because you've talked a lot about how this is a kind of a female dominated issue, statistically, what's kind of the difference when it comes to low desire between men and women?
Great question. There is a lot of attention on Viagra, and Viagra restores erections. But low desire in men is more common than erectile difficulties in men. So it's still about half as common in men as it is in women, the low desire. But it is the most common of the sexual problems that men experience, low desire or lack of desire, and affects young men as often as it affects older men. It is a little bit more hormonally based. So there you can measure testosterone, and it is associated with low desire. But there's a ton of body image issues in young men. Kind of this ideal masculine image. And if I don't have that, it shows up in the bedroom. And there's often performance concerns that lead to loss of erection or loss of desire. So I actually see a lot of young men in my practice as well.
Is there anything, I know you guys are on a time crunch. Is there anything else you wanted to encompass in this? I forgot to mention too, Melissa and Bryn are both here. Thank you so much for being here as well. But is there anything you wanted to talk more about the Debunking Desire? Because I'm so thankful that you guys are giving this a platform and that you have the multitude of accolades to be doing this. So I want to make sure that we give it the respect it deserves.
Oh, the quiz.
I took the
Thanks,
quiz.
Melissa.
I took the quiz.
I took the quiz too.
What was your score?
I got all of them right. Yeah.
The quiz.
Definitely like giving myself a pat on the back.
So embedded in the campaign on the website, debunkingdesire.com, we've embedded a quiz, and it's, a series of true false questions about sexual desire. And it's just a good little snapshot of like, what are some of the myths I might be having. So if you don't get 100% of it on it, it's okay. I understand we live in a world where there's a lot of misinformation, but it's an opportunity to learn more. So we've, for any answer that is scored incorrectly, we provide the correct answer, including some of the science and the citations that go along with that. So I think you'll what we've found is that this has become such a powerful vehicle for educating people, bringing the science to the masses, and making women feel normal and validated, that I think we're going to be doing much more of it. Wouldn't you say, Bryn? More social media. Yeah, Bryn's nodding. We just need more funding to do it. But like I said, we did get funded from our provincial health funding body to do this work. So thank you to you two for using your platform to get this message out. I think
absolutely.
I know at least a third of your listeners will be very grateful.
Yeah.
We have so many female listeners.
I think it's like 99% female. I'm pretty sure. Yeah.
I did just want to ask you really quickly. So in terms of like low desire, like what can women do about that?
Yeah. It's not a medication. I will say that at the outset. Not because I'm anti-medication. I'm not anti-medication. I think there's a lot of things where medications play a really critical role, but none of them have been found to be effective and safe when it comes to low desire in women. And similarly, hormones, they're totally off-label and also not appropriate for premenopausal women. So it's not a hormonal or medication route to go. Thankfully, we actually do have science showing that mindfulness meditation works. It works. It needs to be practiced. I equate it to like, it's like when you go to the gym and you have a great workout, you don't go home and suddenly have the fitness and you're going to have it forever. You have to keep exercising that muscle. So I often advocate, download a mindfulness app. We run groups in our clinic at VGH. You can go to a meditation center, implement some mindfulness in your life, even if it's 10 minutes a day. Again, the science is pretty undisputed that it can directly benefit sexual desire. And then there's other kinds of psychological skills like cognitive behavioral therapy. And that's really helpful if you're someone who has a lot of really distorted beliefs when it comes to sex that really need to be corrected with information. So CBT is very, very well supported.
And with trauma, I would imagine as well.
Trauma, most unfortunately, is a big part of my practice too. And, so if you're a woman who has a history of any kind of trauma, even emotional trauma or neglect, that really needs to be dealt with and can be done in concert with improving your sexuality, but really should not be ignored.
Yeah.
And then, of course, there's all the basic life hygiene things like get enough sleep, watch what you eat, minimize your alcohol, all of those things that just promote general health.
I bring this out every chance I can get. I've been sober for 8.5 months.
Congrats.
Thank you so much. I'll attest to that, man.
Yeah. Your desire's through the roof.
Oh, she is. She's well and alive. Again, Grandma, I see you. Oh, goodness. Well, thank you guys so much. Really quick, where can we find you other than on debunkingdesire.com? So
Twitter, my handle is Dr. Lori Brotto. That doctors in DR, Lori Brotto. Our research website is at UBCSHR. You can find us all over. You can use hashtag Debunking Desire everywhere. And then our research institute on Twitter is at Women's Research. And there you can find out definitely about the research on sexual health, but all of the women's health related research that's happening in BC.
That's so exciting.
That's awesome. Well, thank you so much for being here. This was so fascinating for me.
Yeah, no kidding. Yeah, we're really grateful that you guys came on here. So thank you.
Thank you both.
Yeah.
Thank you. And thank you for giving this a platform.
Absolutely.
So much.
Anytime. All right.
Okay, guys, we will see you next time.
I was going to say peace out.
Oh, God.
On Sam's channel, that's how she says goodbye.
Yeah.
And we both were just about to be like, peace out.
That's awesome.